Do you have a gap between the teeth? Because one of the commonest complaint patient comes to us is between the central incisors there is a gap. The gap can be a small gap or a medium sized gap, but that can be quite disturbing to their smile. Not only to the smile, because of course when there is a gap they don't smile confidently. Another commonest problem that they have is when they speak, sometimes saliva comes out through the gap, so which is very embarrassing for them. So now in this video, let's look at what can be the cause for those gaps and how can we address those gaps, how can we close the gaps. This is Dr. Arun from Pearls Dentistry, running a dental centers at Chennai, Raja, Namalapuram since the year 2001. If you have not subscribed to our channel Pearls Dentistry, please do subscribe to our channel. We've got a whole bunch of videos coming out in the next 1 year. So the commonest cause of the gap is when compared to the jaw size, our tooth size is little smaller. So eventually, after all the tooth have erupted, there is still that leaves a space between the teeth. And since the front teeth is the one that's first to erupt, this space usually ends up in the tooth in front. Another most important cause of this gap is we have a band of tissue called the frenum, which runs from our upper lip to the place between the gums, between the two upper front teeth. It's called the labial frenum. When the labial frenum is attached high, it typically means that it is attached very close to the tooth, between the two teeth at the inner gum. So then in that case, as we speak, as we smile, as we swallow saliva, there is a lot of muscular movement of the frenum in the space between the teeth, which eventually causes the gap between the teeth to increase over a period of time. So another commonest cause is this high frenal attachment, which we need to understand whether there is high frenal attachment, sort it out so that the problem doesn't recur again once we close the gap. Once we have identified this, closure of gap is typically by two methods. One is by braces. We either put a metal brace or a ceramic braces. Ceramic brace, of course, will not be visible at a distance, and then we can close the gap. Of course, we can also do invisible aligners or Invisalign, where with a series of clear aligners, we will be able to close the gap. So typical treatment time can anywhere from 8 months time to about 12 to 14 months time. The reason this time difference I am saying is depending on the amount of space, any other correction that is required to close the gap. So we will also be doing that as a composite treatment, and then we will the treatment is planned. So that's a typical time. But some people don't have that kind of time. They might be traveling abroad for work, or they might have a wedding coming up, and where they don't have that kind of time to close the gap. And in that case, cosmetic dentistry is can provide a good solution to close the gap. When it comes to cosmetic dentistry, there are two methods by which we do. One is a direct chair side composite, where we can have a tooth colored filling material that is layered onto the tooth structure, which helps to close the gap. It looks lifelike, it matches to the color of the tooth, it bonds to the tooth. Typical time it lasts is about 4 to 5 years time. The reason is after 4 to 5 years time, as we brush, as we use the composite can get little roughened over a period of time. This roughened composite can accumulate some food debris and stain, so it doesn't look very lifelike after some time. If you want something that is more natural, more long lasting and more shiny and glossy appearance, then ceramic laminates will work wonders for you. And it can give you a very definitive solution. It's typically done as a two-sitting procedure where we first make the measurement and then fix the laminate. But with digital dentistry and CEREC, we can do ceramic laminates, close the space between two front teeth as a one-sitting procedure, where we actually scan your tooth, design your laminate, and also mill the laminate and fix the laminate in all in one sitting. So again, it gives you very lifelike, natural translucency, and it will be hard to differentiate between a natural tooth and the veneer. So these are some of the commonest causes for the space, and of course we looked at how we can close the space also. If you have any questions, please do ask in the comment section below. We will be happy to answer. Until next time, this is Dr. Arun from Pearls Dentistry. Bye bye and thank you.
Do you like the video? Press the like button. Do subscribe and click on the bell icon to receive such videos. Thank you.